Thank you, Madam Chair. Thank you, Senator. This is a very important bill. So a couple questions. One is do we know child care providers have we spoken to them to see their likelihood of volunteering for this program?
Thank you for the question. We have someone who works with child care providers, and I think she would be a better to answer that question.
Okay. And a follow-up, if I may, do we know potential costs? What are we looking for in this reimbursement?
That's a very good question, and I think that's the crux of the issue why it was retained and why the pilot is more appropriate, because we really don't know what that cost is going to be. And so that's, I think, the very essence of this amended version is to do this pilot, figure out what the actual costs are, what's the differential, and then see if we can build it into the budget next year.
Okay, and one more, if I may,
Sure.
Madam Chair. Attendance base, is that still going to happen? Are we gonna be paying attendance based even though we're doing this reimbursement?
So the pilot program is just for 3 months, right?
Okay. Okay.
And
Great. Thank you.
Are there any further questions? All right, seeing none, thank you so much.
Thank you. I'm sorry, the child care woman who represents the child care providers, Jackie Powell, wanted to ask for that.
Okay, great. Thank you.
So we'll call Jackie Powell, who has asked for 2 minutes. Yes.
While I was moving between buildings,
Yes.
I was trying to listen to the live stream.
The mics aren't working. They
Yes,
know.
there's no, okay.
They know. They're working on it. They're not working in 202 and 204 either.
So I thought maybe it was frozen, and then I saw people moving on screen and realized, no, we just can't hear them.
Can you hear me now? Yep, now we're working.
Oh,
So if you just, yeah, there you go. Just make sure when you, Representative, can you turn yours off?
It is off.
Oh, it is? It's lit up.
No, you're on.
you're on.
There we go. Okay. Just because if you have too many of them on, they don't work.
Oh.
Go ahead.
Oh, good morning. I'm Jackie Cowell from Early Learning New Hampshire. I'm here actually representing 2 different organizations. Early Learning New Hampshire, which we are a statewide organization representing child care providers, the families they serve. We're a statewide nonprofit. And I'm also here because the chair of the New Hampshire Child Care Advisory Council couldn't make it. She works at Merrimack Valley Daycare, and she was needed there at the center, and she couldn't come. So, and the New Hampshire Child Care Advisory Council is a legislatively enacted body to advise the Department of Health and Human Services, as well as consult with the governor and the Department of Ed on child care issues. So I'm here today saying that both of us support this bill. SB 144. Again, the main purpose of this, again, is to pilot, as Senator Whitley said, the idea of enrollment-based scholarship. It's actually the federal government's recommendation that this is the best way to provide what's the child care scholarship, the subsidy system. Those families who are income eligible to receive these services, they can't afford the full cost. So therefore, the state pays a portion depending on their income, and then the rest comes from the family depending on their income, as I said. And so what this bill does, enrollment-based versus attendance-based. Right now we're in attendance-based. There's, we're doing better than we had in other years where you're simply not there, you don't get the child care scholarship. Children are sick, the family can't afford it, the child care provider has to charge them the full cost. They don't have reserves to do it. So it's really, this helps level the playing field between a family who qualifies for their income to get child care and families who are private paying. The typical policy in a child care center is whether you come or not, you pay, right, for a private pay client. Because again, whether the child is there or not, the teacher's there, the lights are on, the heat is on, etc. They can't afford to do it that way. So enrollment-based scholarship in the state child care scholarship system really, again, allows that level of the playing field. It allows programs to open their doors and say, okay, I can open my door to a family who is income eligible. I don't have to worry about not getting paid. I don't have to worry. That's a worry that gets taken off the provider's mind, and certainly it's terrific for the family. That's the number one reason. The family doesn't have to then, their child is sick, they lose time at work. They may work many work at hourly rates, so they don't get paid when they don't show up. Their child is sick. They have to then pay extra to the child care center. It's a really, lose-lose situation. So this mitigates that. That's why we support it. Again, the federal government recommends it as a policy for states, and we're looking forward to seeing what the cost is, the difference between our attendance-based and this enrollment-based after the pilot is done. And to answer your questions, yes. So there are some child care programs in our state, Representative Long, who they do what they're called enrolled in the child care scholarship system. They open their doors. So if a family comes in who's income eligible, can get the child care scholarship, they accept those families. There are some who are not enrolled. And our hope for this, and that number, we do have the folks in the Department of Health and Human Services behind me, but some years there's a large who take in child care scholarship, and some years there's fewer. And we really want everyone in the child care programs to open their doors to any family with any income, as long as, again, it's a good system. And the enrollment-based makes it a better system. More likely they will take children whose families are income eligible because they can afford it. Yeah.
So I have a couple of questions, if I may. So you keep saying if they're income eligible.
Yeah.
Yet on line 7, it says regardless of income. So it says the child care scholarship or subsidy plays a significant role in ensuring all New Hampshire families can access quality, safe, and reliable child care regardless of income.
Interestingly, that doesn't, that was maybe an error. Yeah. So what it is the child care scholarship in New Hampshire system goes up to what's about, I think it's like 65% of the state median income. So in other words, it's a family of 3, you guys know this better than I do probably, $45,000 a year earning. So anyone under that. But again, if you are receiving TANF, if you're at the lower end of the income spectrum, you receive more scholarship. And as you raise your income, you get less scholarship. But it's capped at either 250% of federal poverty level, which is still, like I said, about family of 3, $45,000 a year.
Thank you.
Sure.
And I have one more question. On page 2 on line 4, it says the department shall include, as part of the biennial budgetary process, the full cost to provide enrollment-based reimbursement rather than attendance-based payment to child care providers who accept. So can you explain to me, because it looks like to me that regardless of how this 3-month trial comes out, we're doing this no matter what. Is that my
Yes.
correct understanding?
That is the intent. Of course,
So-
it'd be through the budgetary process anyway, but yes, I understand what you're saying. Did you want to? Yeah.
Can you please?
That language, thank you for that question. That language was added as a result of some significant negotiation with the department. I think there was a lot of support for actually just making the change, but this was, agreeing to a 3-month pilot rather than a longer pilot, or just making the change was the result of negotiations. But here's the thing, depending on the cost, the legislature can do what it will do. So really it just allows it requires the agency to put it in their budget request, but then of course the legislature has a very important role in determining whether it actually makes it into the budget.
Okay, and can you just explain real quick where it says regardless of income?
Yep.
Because I think that's can be misconstrued, because I think you mean that regardless of income, people will be able to get childcare, so that the people that can afford it can. But I think as you read the bill,
Yep.
it sounds like it's saying that regardless of your income, you can qualify for this program.
Thank you for the question. So so you're referring to line 7, correct?
Yeah.
Yep. So in the statement of findings, it's really that sort of regardless of income is more a general statement where we say the child care scholarship plays a significant role in ensuring that equality. So it's not specifically saying that someone has access to the scholarship program regardless of income,
Right.
but that the program in general plays a role in that balance of who can access it or not. Happy to look at an amendment though if that works.
I just feel like it might be a little
Sure.
misleading
Yes.
to people, and we don't want to run into problems further down the road.
Thank you, Madam Chair. And maybe we could add something, just referring directly to the income guidelines and statute or regulations or something like that.
Great, thank you. Are there any questions for Ms. Cowell? Representative Long?
Just better clarity on line 6. So the way I read this is that if I can afford childcare, I'm all set. This program helps for those that can't afford childcare, correct?
Right.
It does.
So making it clearer would be.
Okay, thank you.
And if I can follow up, Madam Chair? Am I right in attendance, currently attendance-based? Hold on. So am I correct with assuming that attendance base currently is on a sliding scale, and that enrollment base would be a predetermined amount agreed to by the provider?
Gotcha. Actually, attendance-based and enrollment-based is different only in how it's paid by the state. So, so there's no pre-agreed amount. What it means is, for whatever they're scheduled for, like private pay clients, the state pays their portion,
Okay.
and the families still pay their portion, whether they show up or not. But attendance-based is whether they come, they may not come, and the state doesn't pay, depending on how many they've been, if they've been out all week, et cetera, et cetera. So it puts the family at risk of having to pay the difference that the state doesn't pay with attendance-based.
Okay, follow up if I can? Sure. Thank you. I'm looking for where this is an incentive for the provider. So
Yeah, it may not be.
is there a better guarantee for the provider?
There
This
is.
scenario?
There is, because of how it's paid out by the state. So if they're enrolled, if the family is a child care scholarship eligible family, right? This only affects these families who are income eligible, of course.
Yep.
So the difference is it's more guaranteed because the state will pay what they're scheduled to attend, even if they are absent. So it's, again, what Senator Whitley said, like a business, you can count on certain income. All the private pay clients pay that way. It's just leveling that playing field. The same method of counting on income coming in.
Okay, and one more if I may? Just to clarify on the HHS budget request. So if this, if this report comes out that it's not working, then I would assume they wouldn't put it in their budget request,
Yeah.
correct?
I think it would be. That's a good question. But I think what this does is trying to figure. The department can speak
Okay,
to that,
I can
but
ask them.
the department is, if it's affordable. My understanding is the department thinks enrollment-based is a good way to go. Right. So it's not, and other states that do it, again, it's leveling the playing field. But so I don't think it's that it wouldn't work. It's just what it would cost.
Very good, thank you.
Sure.
Thank you, Madam Chair, and thank you for taking my question. This entire bill, as amended, was created to allow parents to remain in the workforce, correct?
That's right.
Follow up? Thank you, Madam Chair. Considering the fact that the workforce consists mainly of 3 work shifts, and most daycares are open during the 9 to 5 or 6 or 6 to 6, how many child care facilities do we have that facilitate the 3 to 11 and 11 to 7 group of parents that may be eligible for the scholarship?
There aren't that many, Representative. Again, HHS may have a better and accurate number. What's interesting is that I believe as part of the ARPA discretionary funds for DHHS, there's a look into how to expand and have more of those other shift hours. At the same time, I've been in the field for 30 plus years in New Hampshire. Many centers have sometimes tried to open up those offerings. And what ends up happening is the children, the moms and dads understandably want their children in their own bed, or they want them in, they don't want them in a center, overnight. It's been, when a lot of programs that I've been aware of, anecdotally, that offer it and decide to try it, parents just don't want that option. They want to figure out a way to get reimbursed or help for someone else to be in the family or in a home, but not in a center. But they might be able to answer you in terms of what, if there's any plans underway. I think you may know that even with the center-based, I think Representative Rice sort of mentioned it too, that many families can't access it now, even in the day. That whatever we can do, yeah.
Thank you.
You're welcome.
Are there any further questions? All right, seeing none, thank you very much.
Thank you.
Up next will be Karen Hebert to speak for 3 minutes from DHHS.
Good morning. Thank you. My name is Karen Hebert, and I am the Division Director for the Division of Economic and Housing Stability. And I would like to introduce Deborah Nelson, who is a Bureau Chief in the department directly behind me for the Bureau of Child Development and Head Start Collaboration. And I would like to have her join me to answer some of the more particular questions that I've been hearing so far that she could provide information for. But generally this, and she has one. So this, first of all, I do want to thank Senator Whitley for the work that she has done, tremendous work that she has done in supporting child care in the state. Thank you. This bill is really all about supporting families better as well as our workforce in the state. So in order to, this, as Senator Whitley mentioned, this is one step, one particular thing that we can do to support childcare in the state and strengthen it. And one of the things that this does certainly is looking at the cost for an enrollment-based program compared to the current absentee billing program that we have right now. So essentially, if we are able to show that this really has been effective for families, it may increase the utilization of the Child Care Scholarship Program. This is a federally funded program that at the moment is arguably underutilized, and we would like to see an increase in that. Any questions, I'm happy to answer or defer to Ms. Nelson.
Representative Long.
Thank you, Madam Chair. So the CCDF is underfunded. I mean, not underfunded, it's underutilized. And you're hoping that the enrollment-based will increase utilization of this funding.
Yes, so there, at the end of calendar year 2021, there were 799 providers across the state. 608 of them at the end of that year were currently enrolled in the scholarship program, accepting families who were eligible for the scholarship. So we anticipate that we could do better and increase the number of providers who are able to use the scholarship program for families. That would increase the number of families able to have childcare so that they can get back to the workforce.
Very good, thank you.
Seeing none, thank you very much.
Great. Thank you.
Up next is Rebecca Watkowski, who has asked for 2 minutes and does have written testimony.
Good morning. My name is Rebecca Voikovsky. I'm the Kids Count Policy Director at New Futures. New Futures is a nonprofit, nonpartisan advocacy organization that educates, advocates, and collaborates to improve the health and wellness of New Hampshire's kids and families. So I am here today to talk about our strong support and partnership with Senator Whitley, Early Learning New Hampshire, and our state partners in looking at how enrollment-based billing can be used to help families access child care scholarship. I'm just going to speak to a couple of questions, although I've handed in some robust written testimony about how access to childcare is primary prevention. It's also good for the workforce, but we know that it helps mitigate ACEs and trauma that children may face. And we know that is an issue for our state. In speaking with Senator Whitley just now, I think that a suggestion, if the committee would take it, would be to just strike lines 6 and 7 instead of trying to come up with additional language. I think that's a finding. I don't think that it's important to the context of the bill, and I believe Senator Whitley agrees with me there. I just want to emphasize a couple of things. Number one, as Jackie Cowell spoke from Early Learning New Hampshire, enrollment-based billing is promoted by the federal government as a policy around child care development block grant dollars. It's also a explicit authorized use for federal discretionary child care development block grant dollars. So when COVID hit, there were different relief dollars. There were specific dollars for child care in this program. This is an authorized way to use those discretionary dollars, just so the committee knows that. The other thing that I want to talk about is that the state did use enrollment-based billing during the pandemic as a way to stabilize the child care market. It wasn't a specific program change. They used disaster billing. They could fill you in on exactly how that works. But to kind of answer Representative Long's questions about whether or not this would be a program that worked, we know that it did work. I don't have the data of how many more families, but we know that it stabilized the market. We know that it's important from our families' perspective that we hear that it allows them to really consider childcare if they know that they're not going to be penalized if their kid is out. We still have restrictions around COVID if you're out for 5 days. So I'll just represent that we're in strong support of this bill. We have worked with Senator Whitley and state partners. I'm happy to answer any questions, but a lot has been covered already.
Are there any questions? Seeing none, thank you very
Thanks.
much. Okay, so I'm going to close the public hearing on, yes, I'm going to close the public hearing on HB 144. And then, oh, we're doing good, okay. I'm going to open the public hearing on Senate Bill 326 as soon as the clerk is ready. Are you ready? Okay. Yes, Senator Becky Whitley to speak for 5 minutes. Can you pass those down? Thanks.
Thank you, Madam Chair, and good morning again to the members of the committee. For the record, my name is Becky Whitley, and I'm honored to serve New Hampshire Senate District 15, including the communities of Concord, Henniker, Hopkinton, and Warner. So this bill, Senate Bill 326, as introduced, established an Office of Early Childhood to coordinate, consolidate, and integrate early childhood programs. As our system is currently designed, there remains an alphabet soup of state agencies that provide a variety of services to our young children and families. And and many families, and even as a legislator, I can attest to that this system is confusing, complicated, and hard to access. So the idea of creating a single Office of Early Childhood will actually empower our families with a one-stop shop for the care and support that they need. The amended version that you have in front of you looks a little different than how the bill was introduced. It retains the important findings that led to the bill, but instead of actually creating the office, it directs the Commissioner of DHHS in consultation with the Commissioner of Department of Administrative Services and the Commissioner of the Department of Education, the Child Advocate, Council for Thriving Children, all the people we know who are experts in children, to develop a plan to actually create the office by November 1st, 2022. So pursuant to the bill, this process and timeline will track with the steps that are actually already in motion through the Council for Thriving Children and work at at DHHS, and ensure that there's a plan in place answering some of the questions that were raised in the Senate, in time for the next budget cycle, right? So I just wanted to sort of back up towards about why this is really important. I think folks on this committee know well that research across a lot of disciplines has shown that the early years of children's life are incredibly critical to healthy brain development. I think it, what shows us is that, what happens in a child's early years will be so important to their readiness for school and, of course, their readiness to participate in daily life. So I think in addition to what we know the research says about the benefits to children, I think it's important to also look, we are legislators, it's important to look at the financial side of things. And research has shown us that there is a significant return on investment in early childhood. If we're investing in early childhood, we see a lifetime of higher earnings, improved education outcomes, reduced criminal justice cost. That research is old and it's well established that we will see those cost savings if we invest in early childhood. So as I mentioned before, the state of New Hampshire currently does have investments in early childhood, but it's a very fragmented system. It's just, as with a lot of things, things are fragmented through various funding streams. That is no fault of state agencies. It's just the way that we do things in New Hampshire. So because of the state government has already identified that this is a problem, the Department of Ed and the Department of Health and Human Services already have a team that is looking at more integration of early childhood. They are already on the way to doing this work and moving towards a more integrated early childhood system. And I think the department can speak to that work, but they do have a team looking at this across the two different departments. And I think from their perspective, eventually creating an Office of Early Childhood can hopefully result in more efficiencies. And then, of course, from my perspective, thinking about families, greater access to the services that our families need so desperately. So as you can see from the sponsors and just from your own work, early childhood, it really is a bipartisan issue. On January 23rd, 2020, Governor Sununu issued an executive order creating the Council for Thriving Children. And in that same executive order, the governor also directed DHHS and DOE to work towards establishing a joint Office of Early Childhood and Education. So it's right there in the executive order. This is just the legislation that is necessary to effectuate that executive order. So the purpose of this bill is to build on that vision, to keep us moving forward. Of course, within state government, we always need those measures of accountability that keep the work moving forward. The original version of the bill certainly had a phased-in approach. I think this plan also looks at that phased-in approach. And I will note, too, that there are a lot of other states that are looking at this. Colorado, California, Connecticut, Georgia, Hawaii, Massachusetts, Montana, New Mexico, Utah, Virginia, Washington. They are already moving in this direction. Many other states this session and last session also have bills to move in this direction. So I think we can all agree that the first years of a child's life are so critically important, and that those years should not be sort of caught in bureaucratic mess and morass. So I think you'll hear from other folks why it's so important to have the full attention and focus that's equal to the importance of this time of life, and how this will really work to integrate services for maximum impact of these investments. So thank you for your consideration. I'm happy to take any questions.
Are there any questions? Representative Yokella.
Thank you, and thank you for taking the question. You stated that early childhood is, an important time in a person's life, but you didn't explain really what the role of government is in the early childhood, and what it is trying to do, as far as we're not actually parenting the child, and so what is it doing as far as like the goal of this office, I guess, is it just educating parents about the opportunities for services and of the needs that are offered by the state currently? So it's more of a way to advertise for that, or is it something else that I'm not clear about? Thank you.
Yeah, thank you for the question. So already in New Hampshire, there are a lot of state dollars going to early childhood, child care, right? There's both state and federal dollars in the child care scholarship program. There's state and federal dollars on other programs that impact early childhood, but they're sort of dispersed around state government. And I think the whole idea is that to maximize those investments that are already there, right? And then to leverage those investments, we have a ton of federal money coming in. To maximize and then leverage those investments, we need a more integrated system. It's too spread out, and there's not full attention about how to maximize those investments. So I think the education piece that you described is incredibly important. How do families access, the support that's so desperately needed? I think that will absolutely be a piece to it. So it's multi-pronged. Did that answer your question?
Yes, thank you.
Are there any other Representative Altschiller?
Thank you, Madam Chair, and thank you, Senator Whitley, for bringing this forward. On the first page of the bill, part 4, line 16 through 20, do we have are there any reports that, I know everybody, because of the nature of the response to the pandemic and making sure that families got those supports when the public health issues around the public health challenges created around the pandemic meant that a lot of agencies and a lot of nonprofits that support our agencies were scrambling. We were scrambling. But now that we are looking at how do we do this better, because that scramble uncovered a lot of gaps, which is why this is here. Do we have any documentation from the Department of Health and Human Services and the DOE about what they did?
Thank you for that question. I think, so after the executive order created the council, maybe a year later, the Council for Thriving Children, which is it's a public-private partnership. So the chairs of that council are DOE and DHHS representation. There is an executive director. So it is a public-private partnership. They issued a strategic plan on early childhood in the summer of 2020. So that, sort of provides the benchmarks probably that you're identifying. And then right now they are in the process of updating that strategic report through a very robust process that others behind me can discuss. And that should be ready before the next budget cycle. So the fall or December. And so I think in that you probably will see more about what was exposed throughout the pandemic.
Follow up?
Thank you. Thank you very much. So if I understand you correctly, what you're saying is that strategic plan will actually more or less provide the framework for this childcare initiative.
That's my understanding, and that's why we really tracked their timeline, and tracked that in the bill.
Thank you.
Representative Alicia?
Thank you, Madam Chair. Thank you, Senator, for taking my question. I'm not sure if this will or will not have anything to do with the actual scholarship program, but if a family is receiving services through DHHS and they apply for the scholarship and they get it, they're approved, would it in any way lessen what they get as a family food stamps or other funds that they may receive from DHHS?
I think that's a question for DHHS. I don't want to provide misinformation about that.
Okay,
Thank you for that important question.
Thank you.
Are there any other questions? Representative Long.
Thank you, Madam Chair. So just to clarify in my mind, this is an attempt at a collaborative effort. So if I'm taking the opportunity of a service that New Hampshire offers, I may not be aware of all the other services because there isn't a collaborative effort. So would I be more aware setting up this joint office on other opportunities I may need with my children's early education?
Thank you for the question. I think that's exactly right. As I discussed with Representative Yokela, it's a both, leveraging our current investments and also, more helpful for families. The other thing I wanted to mention, and you made me think about that, is that, in New Hampshire, we have to move to a place where we're less crisis focused and that we're more future focused and that we are, not just throwing a lot of money at problems once they happen, but we're preventing problems and that we're planning for the future down the road. And we know that whatever is coming down from Washington, there continues to be significant bipartisan support for investment in early childhood. What that looks like and how much is very unclear, but there will be significant federal investment fairly soon in early childhood, both on the child care side and potentially pre-K. And if that happened tomorrow, we would not be ready in New Hampshire for that. So this office provides the necessary structure for incoming federal dollars that we know are coming.
Great, thank you.
Are there any further questions? Seeing none, thank you.
Thank you.
Up next is Rebecca Watkowski. I know I'm killing that
fine.
name.
My maiden name was Stevens, so I
and-
should have stayed with that.
And she has, yes, she does have written testimony,
I
and
do,
she's asked
sorry.
for 2 minutes.
Can I pass this? Hi again, Rebecca Voikovsky, Kids Count Policy Director at New Futures. I'm here in strong support of Senate Bill 326 as amended. Again, I'm here to talk and represent the strong collaboration between Senator Whitley and our partners at DHHS and DOE around this bill. I also want to share that I am a parent representative on the Council for Thriving Children, and I am also the co-chair of the Strategic Planning Subcommittee. I can't speak on behalf of the Council for Thriving Children, but if there are any questions around the work of that committee, I can speak from my experience. I just want to confirm a couple of things that Senator Whitley spoke about. The idea of how to better integrate our early childhood system from birth through 8 has been an ongoing theme for a long time. It's not a new idea. New Hampshire actually received in 2019, before the pandemic, $26.8 million in the preschool development grant. Excuse me. The preschool development grant is a misnomer for most people. It has nothing really to do with the development of preschool in New Hampshire. It has to do with the development of a better coordinated system for kids and families. And if you happen to see, as part of that, Governor Sununu's office created this great visual, I'm sure our friends at the department could show you, about what that structure is. It created early childhood integration teams in DHHS and DOE, and also created connection to this larger Council for Thriving Children. And the Council for Thriving Children has diverse membership, parent representation, advocates, representation from all different fields, understanding that children exist within families, and those families may have different touches in parts of the system, but we have to acknowledge that it's not easy for families to navigate. So I say that all to emphasize that this bill is really timed with the work that's going on right now. It allows a touch with the legislature to understand what the ongoing process is and to make an evaluation on how we best leverage existing funding streams, how we improve on the internal side and also on the external side for kids and families. And the last thing I'll say is that preschool development grant, it ends in December. So this bill is also tied with the end of that so that we can look at what parts of that investment can we sustain or should we sustain, and how can we best do it in a way that is fiscally responsible for our state. I'm happy to answer any questions, but other than that, I'll refer to my testimony that I submitted.
Are there any questions?
Excuse me.
Representative Grossman.
Thank you so much, Madam Chair, and thank you for coming and presenting this important work. As a mother of a child with autism and twins, I know the importance of those early childhood years and the payoff that comes later on, and we have used those services, so thank you. What I wanted to clarify was, what specific years are we talking about when we reference early childhood? So is it birth?
Thank you for that question. That's really great. So I'll explain a little bit. The preschool development grant looked at birth through 5, but our state's Council for Thriving Children looks birth through 8. So there's a warm handoff to DOE.
Great, thank you.
You're welcome.
Are there any further questions? Seeing none. Oh, no, I see one. Sorry. Representative Yocala.
Thank you for taking the question. Do you see this as just a reorganization of our current system, or do you think that this is leaving those systems in place and kind of creating an overarching structure on top of them to, facilitate the information sharing about these programs and coordination between them?
I'll speak from my role on the Council for Thriving Children in view of this. I don't see it as building out another government structure. I see it as through the process of strategic planning, looking at how we are serving families and creating a more streamlined approach to providing that and ensuring that it gets out to more families. So I would say it's an assessment of what we're doing well, maybe what we're not doing so well, and how to improve it with existing dollars. There's always the opportunity that we may be leaving some dollars on the table for kids and families. So, I think that adding in my role as an advocate for early childhood programming, it really is starting to look at how the systems are coordinated, how are you catching families, and really giving them the skills to be thriving and well. One example is looking at home visiting programs. How are we getting new moms into home visiting programs, and how's that tied to family resource centers that also provide services for, other family members within that community? So it's really, I think we've had a history of providing one service and looking at a child in a silo. This is really building up a system that looks at a child existing within a family and ensuring we're giving them access to services that allows them to keep the family intact and to be thriving and well, because that's ultimately what we want for kids and families.
Representative Smith.
Thank you for taking my question. Do you work with pediatricians as well to get them, if a kid is slow to talk, like my daughter was, cognitive, not where they're supposed to be? So do you work and educate the doctors of what, they need to look for to give children services?
Yeah, thank you for the question. Just to clarify, I'm not a service provider, so
Okay.
We do advocacy, and pediatricians are a population that we aim to include in all the programming that you said.
Okay, thank you.
Thanks.
Are there any further questions? Seeing none, thank you.
Thank you.
Up next is Karen Hebert from DHHS. She's asked for 3 minutes.
Good morning again. My name is Karen Hebert, Director for the Division of Economic and Housing Stability for the Department of Health and Human Services. So I just wanted to comment that, certainly this bill, and again, thanking Senator Whitley for her work, this bill really enables us to take some pretty significant steps towards really creating a solid foundation moving forward, which is that plan, and identifying what is it that would answer the question: can the various services and programs across multiple agencies that relate to early childhood, can they be more cooperative together and more effective and efficient in a single office? There is certainly fragmentation across the services, multiple services for early childhood. And as the representative from New Futures had pointed out, there are many reaching branches to each of those, where she may have access to groups like pediatricians, where the department in our particular role is not a typical connection that the department would make. So there are multiple different services, and this basically provides the opportunity to have that long overdue conversation so that we can really look at the number of services of early childhood and make some determinations of how can we build a plan that would create a better service for families and for children. So we're hoping that the work that has been done over the last few years by the Council for Thriving Children, as well as the Preschool Development Grant, could really inform this particular plan, and that we could use that work that we've already done to start building off of that, and really take a look under a microscope at how to create a better system. Thank you.
Okay, so I have a quick question. So for this, I see that when all the bodies get together and decide what's going on, is this going to create new positions, or are these going to be positions that we're going to pull from each department for people that already are doing these jobs?
Thank you for the question. So that is the necessary part of the conversation, for all of these entities to gather together and look at every aspect of how we're delivering those services, what resources are needed, what resources could be streamlined, where we can work more collaboratively together and not duplicate services as well. So every component of this, commissioners from DHHS, DOE, the Office of Early Childhood, Child Advocate, and the Department of Admin Services and the Council for Thriving Children need to have those conversations to make that recommendation in this particular plan. And although November is not that far away, I think we're optimistic that this is something that we could do to formulate that kind of a plan.
Thank you. Representative Yokela?
Thank you for taking the question. What is holding you back from doing a large portion of this work now, especially what services HHS offers, and there's a bunch of services that you may be aware of that you could point other people to if they were seeking help. As far as the advocacy, as far as the awareness for doctors or families that are in need of services, what is the struggle for being able to advertise essentially those services out to the people that need them, and currently, and also I forgot my other question, so I'll let you answer that one first.
Sure.
Thank you.
Thank you for the question. So the bill basically ignites some energy into creating the steps that we need to be able to look at this across multiple services. And I think that we're all so focused on our competing priorities in each division, each department, each program, that it's hard to stop and start focusing on it. But I think that the work that we've already done through the Council for Thriving Children and the Preschool Development Grant is pretty significant. That has been moving forward. So I think that this basically enables us to build upon the work that's been done and continue moving in that direction. Not sure if that answers your question.
Follow up?
Thank you. And thank you for taking this follow-up. So there's already this commission that was formed by the governor, and so there's already some enthusiasm, I would say, towards addressing this issue. And I don't believe that representatives from the agency, whether it be children and family or all these people that are listed, would decline an invitation to go to that, to the currently created, what is it called, board? the currently created
council.
council, yeah, to try and form this plan, I guess. So, I guess what is this adding that they couldn't do by just going to that council now and creating the plan?
Thank you. I think that, the intent to be able to develop a plan that may inform the department's budget and what we may end up moving forward in, if we were to create an Office of Early Childhood, we certainly want to do that very methodically, very thoroughly, but also to inform policy, to inform the budget going forward. And I think that this is certainly motivating a number of the agencies, all of us, to get together and make that happen. Is there a barrier that's in the way at the moment? I think the barriers are certainly, we could speak to our own barriers, and with the complexities that this involves, incredible complexities across multiple agencies, and to have a means for creating that pathway and having us come together, I think has been an important part of this particular bill. It's not to say that we couldn't do it otherwise. However, I think that to enable us to really bring all of these groups together, that's what the bill essentially does. And looking at some of those barriers may include also the fact that, as I mentioned earlier, we all have highly competing priorities that we're contending with. And so trying to identify really across multiple programs that we're basically saying this is a significant priority to all of these agencies, and being able to come together, including the ones that are named in here, Department of Administrative Services, the Office of Child Advocate, the multiple components that make up the Council for Thriving Children. The bill basically enables those programs to do this.
One more follow-up?
Yeah. Thank you. It seems like from the testimony that I've heard so far, that creation of this or the integration of this was kind of within the scope of the executive orders creating this council for the thriving children, and so the creation or that executive order was essentially this bill that says we want you to come up with something to create this childhood streamlined process of services, and so I'm still just struggling with how this differs essentially from the scope of work that the Thriving Children Council worked on. Are you aware of?
So the Council for Thriving Children, so the early childhood integration teams that were pulled together for that really includes the Department of Education, the Department of Health and Human Services, and community programs. So there's a lot that makes that up. However, this expands upon that tremendously, including the Office of Child Advocate, including the Department of Admin Services, along with DHHS and the Department of Education, to look at formalizing the creation of an office. What can we formalize across those departments that they can each inform it, we want to do this the right way? And looking at this as an opportunity to take perhaps the only opportunity that we have to be able to do that, do it once, we want to do it right.
One more.
Thank you. Thank you for taking the follow-up. Since you seem to have stressed multiple times about wanting to be thoughtful and take our time to get it right, and yet the deadline is November 1st, right? And so can you comment about how you think that the deadline of November 1st allows you to be take that thoughtful, methodical, get it right approach?
Absolutely. So the November 1st deadline is to create a plan. Just the plan. The implementation of that plan is another phase. And what that looks like, how it may be altered or changed beyond the plan, we have yet to know.
Representative Long?
Thank you, Madam Chair. Thank you. So oftentimes in government, local, I do this in Manchester a lot, is collaborations. So a lot of entities, they want to keep their gig, right? I don't blame them. They're a nonprofit. They're doing well in their sector. However, so collaborating with other, with other entities of the same fashion, is this to help that collaboration? So even though we may not, we have all these entities out there, we need somebody to get them together to make sure we're getting our best practice efforts in place. Is that part of this office doing, like, for example, the OCA, right? Why do we need an OCA? We have DCYF, we have HHS, but the OCA sort of puts a couple of issues into one basket, which helps us. Instead of looking at three different entities, we look at the OCA, and those entities are included in one basket.
Sure.
Is that the same effect?
So I would state that I believe the Office of Child Advocate had a bit of a different purpose behind it.
Well, yeah,
So the Office of Early Childhood, I mean, this intent, yes, to answer your question, is to be able to create a plan of what, so again, the representative from New Futures mentioned, of just trying to identify what is working really well and what isn't, where can we make improvements to improve the system of services for families, for children. So that's what a lot of this is, what we're hoping to accomplish as we start convening to talk about the development of a plan.
Okay. And just to follow up on me, I've heard reference of OCA, the Office of Child Advocate. I don't see it in here. I don't see the OCA in here.
It's in here.
Line 27? Boy, people love correcting me. Oh, I do see it. I didn't highlight it. Okay, very good. Thank you.
You're welcome.
Representative DeSimone?
Thank you, Madam Chair. Thank you for taking my question. I'm still struggling a little bit here. 2 years ago, on January 23rd, the governor issued the executive order. I'm not understanding what has taken place, how far you've come in the last 2 years, that your belief is that you can accomplish the task by November 1st. It's really a struggle for me. Can you answer that?
I think it would be helpful if the Chief Deborah Nelson were to answer questions about the progress of the Council for Thriving Children. She's a bit closer to that than I am.
I still need a pink card from her for the last bill also, and if she's, oh, it
made
did,
its way.
okay. And if you're gonna speak on this one, I need you to fill out a pink card for this one too, please.
Yep.
Hi, members of the committee. Deborah Nelson. I'm the Bureau Chief for Child Development Head Start Collaboration at DHHS, and I'm also a member of the Council for Thriving Children. And I'm also on the planning committee for the Office of Early Childhood and the strategic plan going forward. So lots of irons in the fire, like all of my colleagues here. And when you ask about the progress, and that's such a good question, because we had a huge pandemic that really derailed our forward momentum on this work of integrating all of the services and the opportunities across the state, within and across DHHS to DOE and with our partners in the community. However, despite the pandemic, through the efforts of the council and in particular the early childhood integration team at DHHS, and then our counterpart at DOE, and then the integration of the integration teams, we also meet joining the integration teams. We have integration everywhere. I am just astounded at the progress that's been made, you know, where the rubber hits the road of services, like in this past year especially, being able to leverage dollars. I take our Bureau of Child Development Head Start collaboration dollars, put them on the table with maternal and child health and public health, and we co-fund things and we work together. When I develop policy, we bring in our child care licensing partners and our DCYF partners and, you know, advocates and others to look at the policy that we are, you know, looking at changing our rules. And so, you know, just the fact of having worked, you know, monthly meetings, couple of hours every month over a year with a set agenda and addressing specific topics of different areas relative to an integrated effort in early childhood has really brought us a long way. And I think if the committee is interested, we could look at an update report from the integration team, so you can just see some of the work. But I think some of the things that are most exciting to me is when I get a call from public health and say, I understand that you fund Pro Solutions, you know, Care Solutions, which is a online platform for providers to be able to take courses online in their jammies or whatever, and many of them free. Is there any way you can put up a course for us on environmental health? Because we want to make sure that child care and early childhood programs understand the impact of the environments in which children are learning, playing, thriving, and the staff are working. So we said, sure. So we pooled our money. We're going to get those courses up online. They'll be free and available. So that's just one tiny sliver of an example of true integration. Their money, our platform, and getting it out free of charge. Another example, and this one has been underway for a number of years, is our Watch Me Go developmental screening system. That was truly taking slices of money from across like 4 or 5 different parts of the system, pooling it together with no general funds, just, you know, whatever federal funds we could cobble together, and creating a developmental screening system for New Hampshire. New Hampshire didn't have one. So I hear, you know, you talk about your children and how do we make sure they get services early. Well, there's one answer. So, you know, one of the things that we'll be doing through an integrated effort is really strengthening and expanding that developmental screening system so that all children who need support and services are identified early and the families get the support they need to make sure those children are on track. So those are specific examples. I could go on and on. You know, there are many, but I think as Ms. Hebert described, we still have a ways to go. We still have, you know, some of our barriers in terms of how our funding is defined for what it can be used and what it cannot be used for, and who the population that is defined federally for us of who gets served by those funds. But I think, you know, I've been in the state for 15 years now with the state of New Hampshire. Before that, I was at University of New Hampshire doing early childhood grants. And I've seen over my 15 years such huge progress in working hand in hand, you know, within and across the department. So I think this is an exciting time, sort of a perfect storm for New Hampshire to really move forward on a plan that will formalize some of the integrations that we have begun. So we've begun. We have a long way to go.
Thank you. Are there Representative G. Simone?
Thank you, Madam Chair. Thank you for taking my question. I keep hearing about barriers with funding. Once the collaboration is done and the work is done, do those barriers go away or do they continue?
The barriers will continue. Our approaches will try to work together. So there's options to braid or blend funds. Some funds you can braid together, like I'll put my dollars on the table with yours and we'll have a bigger pool to support families and children, but I can't, you know, maybe give your department my dollars, you know, it's just we have to pool it. Whereas blending means we actually put the funds together and have a bigger pot of money. So, you know, those are the kind of federal barriers that we face, but states, I won't say get around them, states work with what they can work with to make it happen for families.
Are there any further questions? Seeing none, thank you.
Thank you.
What? Oh, I'm sorry, Representative Alcia.
Thank you for recognizing me, Madam
Sorry,
Chair.
I didn't even see your hand.
I actually had the question for Karen Hebert from DHHS, who was originally
Okay.
at the table.
Yeah.
If you wouldn't mind. Thank you so much for coming today and sharing your testimony with us. We very much appreciate it. I'm sorry to repeat the same question that I asked the senator. I'm just curious. It's referencing if persons are currently receiving services from DHHS and they apply for a scholarship, does it lessen the funds that they do receive from other programs, or does it just even out?
I'm so glad you asked that question because
Thank
it's
you.
a really great question. So the answer is yes, it could. So what we're currently doing, there's quite a large project across the department that we're looking at what's known as the cliff effect, where individuals who, if they have an increase in their income, may find that they become ineligible for certain programs, yet the increase in the income does not outweigh what they were finding helpful and benefits. So one of the things is looking at across the eligibility programs, childcare, SNAP, TANF, for example, Medicaid, what are the eligibility requirements and what happens when somebody now applies for TANF, for example? How is that impacting their eligibility for child care? Is there a disregard of certain public assistance programs to be considered in eligibility for other programs? So there's a lot of alignment that we really should be looking at. So we've started that process very recently.
May I follow up?
Follow up.
I want to thank you for that. I live in Bosquen, and we're a poor town. And when programs come up like that, the first thing they say when I approach them is, I don't want to apply for that because it's going to lessen my food stamps, or I'm not going to get this.
Right.
So it's really important to know that. So I want to thank you. It's not a question. I want to thank you for considering sharing that information going forward.
And there's some of those rules, or some are embedded into federal regulations that we can't change. So what is it that we can? So there are some eligibility criteria that we can look at changing, but we want to make sure if we make a change, what kind of impact is it going to have in many other aspects? So we don't want to do more harm than good.
Thank you. Thank you.
Are there any further questions? Seeing none, thank you very much.
Thank you.
Okay, so we're running past our time, so I'm going to hold you to the time you put on your pink card. Jackie Cowell has asked for 2 minutes.
Good morning. I'm Jackie Cowell from Early Learning New Hampshire. The only thing I would add or emphasize is that this particular bill really gives a legislative imprimatur on this. You know, there's an endorsement. You're just saying the legislature is saying, yeah, let's have that plan, right? And it likes the excitement. I do think it's possible we would keep going year after year without doing it, even though it's in an executive order, without the legislature saying, like, this, you know, this is important to do, to have this plan. You know, I would ask the House to do the same that the Senate just said. Yes, let's have this plan. Have this branch of government be part of saying it's important to do. And I do think it's possible by November 2022 because there's been a lot of work that people will be building on over the years.
Are there any questions? Representative Levesque?
Hi, thank you for recognizing me, and thank you for taking my question. Has any of, because in Barrington we have early childhood learning center in many other towns and cities do also, has any teachers reached out to you willing to help out with this office, or any of the department heads from them reached out to you about this?
And I didn't catch all of that, and I apologize. I didn't catch all of that. My ears aren't great. Sorry.
Has any of the early childhood learning centers department heads or teachers reached out to you willing to work with you or the
I
center
love that question.
about that?
Sorry. The Council for Thriving Children is very much a public-private partnership with community stakeholders, family stakeholders. So early childhood programs, early learning programs. I'm hoping this part of this plan, as well as the strategic plan that was talked about for early childhood, birth through age 8, all the programs and services that touch the life of a child and their family will be part of this.
Are there any other questions? Seeing none, thank you. Up next is Deputy Commissioner Brennan to speak for 5 minutes for technical assistance.
Good afternoon, almost. I'm Christine Brennan, Department of Education, Deputy Commissioner, as well as I chair the Council for Thriving Children with my partner Trish Tilley from DHHS. Just to back up a little bit, we did have a PD development grant for about 23. Actually, the exact number is probably $28 million to help us with this work. The governor has asked us to develop an Office of Early Childhood, and that's what we are in the process right now of doing with our we hired a facilitator to help us with our strategic plan, Greenway Associates, that's working with the council, and you met some of the members here that are on the council, but it's also other state agency commissioners as well as some of our partners. So I just wanted everyone to know if they had any other specific questions, if I could answer them, because it seemed to be, I knew it was going to be you.
Representative Yokella.
Thank you. Thank you for taking this question. It seems like a lot of this integration, promotion, and promotion of parent knowledge, enhancement of interoperability, expand access, and improve transitions. All of this was in the scope of the Council for Thriving Children. And so how do you see the Office of Early Childhood's role as separate and distinct from this, or do you think that it would subsume all of these goals of the current council?
I think that it would subsume many of the goals there, and so I just to give it a little bit more context, I think that when you think of the integration that's needed with the Department of Health and Human Services, their jurisdiction is really over the family and kids up to 4 years old, where the department only we have the children from 5 on, and this works with kids B through 8, and we know that early interventions are the best indicators for kids to be successful in school. And so thinking about what are some of the gaps or some of the duplications in services that we can improve in this office, and thinking of a mixed delivery service for families, because each child is so unique in what they need, and each family is so unique in what they need to be successful in school. And I'm thinking about school and their education, and specifically when we think B through 8, I'm thinking about that 3rd grade reading score. How do we make sure that these early interventions can help our children be successful in getting a great education?
Are there any further? Representative Altschiller.
Thank you, Madam Chair, and thank you for taking my question.
Thank you.
So the executive order was issued on January 23rd of 2020, which builds on the work that had already begun in 2019.
Mm-hmm.
Is there a sunset on that order?
On the executive order, I'm not sure about the executive order, but I do know that our grant ends this December of 22. And there is whispers of an extension on the grant of the money that's not being funded, but we can't make any plans until something like that happens. So,
so to that, and I see some head shaking that no, there's not a sunset happening behind you, just so you know.
Thank you.
So the grant that is funding the work to put together a plan is going to be up in December, and the plan should be finished by November, which gives, so if I'm tracking this correctly, as anyone who's worked with a federal grant, you want to be done a little bit early so that you can review and also leave that room for a possible extension application. Is that what I'm hearing?
Yes.
Okay.
Thank you.
So this is
Yes.
all part of reporting out the grant.
Yes, and reporting to and letting the governor know what happens from from our strategic plan report to him, and to hopefully fulfill his ask in the executive order of an Office of Early Childhood.
Thank you for clarifying the timeline and the purpose of this grant and why we're looking to get this done by November. It's not, you're saying it's not an unreasonable ask because the work is already happening.
Exactly.
Thank you.
Exactly. There's been a nice blueprint laid out. So thank you very much for your question.
Representative Belanger?
Thank you, Madam Chair, and thank you for being here and taking my question. So I'm slightly confused. There's obviously a cost to this, but the fiscal note says that there's no impact to cost. I mean,
So,
Where-
excuse me one second, just in here, we're about policy. Okay, finance worries about cost.
okay. I would disagree with that, but I guess I'm confused. There's obviously a cost that, could you explain where that cost is coming from?
So I think like I'm going to go with our Madam Chair, that right now it's what are our resources that we have in the Department of Health and Human Services? What do we have in Department of Education? And what would, I think that the strategic plan, and when we work with these folks, we can see what's the best place for the Office of Early Childhood to sit and what's probably the most fiscally responsible.
Are there any further questions? Seeing none, thank you very much.
Thank you.
And up next is Anne Marie Banfield to speak in opposition to the bill, and she's asked for 3 minutes.
Thank you. For the record, my name is Anne Ray Banfield. I'm a parental rights advocate in New Hampshire. I tend to speak at the House Education and Senate Education Committees because my focus is on academic excellence in education. I don't have any written testimony, but I did come here because, actually, you just hit on my points. I looked at this bill and I thought, are we expanding the bureaucracy? As a parental rights advocate, I deal with parents all the time who have specific issues with their children. And a lot of times it's not because we don't have a bureaucracy, it's because they don't have access to what they need. I'll give you just a for instance, there's been bills in the House Education Committee or the Senate Education Committee focused on mental health in the schools. Well, I hear from parents who have their kids sitting in a hospital for a week waiting on a bed to get into the one mental health facility in the state. And so I'm looking at this going, you want to spend money in the schools on this, but I've got desperate parents whose children are suicidal. And so when you asked about the fiscal note, that's exactly what I'm looking at this going, are we going to be spending more money on this as a state? And we have to prioritize this. I'm not saying that this isn't important, and if we had unlimited resources, maybe this is something that we would look at. But the last speaker brought up, looking at reading scores. Well, oftentimes it's because schools use faulty reading programs. How does the bureaucracy fix that? So that's what I would just caution you on is just, are we expanding a bureaucracy with limited resources? And if that's the case, my plea to you is to speak to the parents, speak to the people who are trying to get access. And yeah, maybe there are some hurdles, and you heard that they're not going to be removed. And maybe this would streamline it somehow, but if there is a cost involved at all, I'm just not sure that that's where we want to be spending our money. I think we need to make sure that we're spending the money to reach the people who need it. So thank you for listening.
Are there any questions? Seeing none, thank you very much. So I'm going to close the public hearing on House Bill 326. And as soon as you're ready, I'll start the next one. You ready? All right. So, yeah, I wrote it on my thing. Thank you. Yeah. Okay, so I'm going to open the public hearing on SB 457, and I will call on Senator Sharon Carson to speak in support of the bill.
Thank you very much, Madam Chair, and good morning to the members of the House Children and Family Law Committee. For the record, my name is Sharon Carson. I have the pleasure of representing Senate District 14, comprising the towns of Londonderry, Hudson, and Auburn. And I have this morning for your consideration Senate Bill 457, which, as it was introduced, establishes a committee to study nonprofit organizations contracting with the Department of Health and Human Services for Children's Services. Madam Chair, this bill came about because I was approached by a number of entities that are dealing with our Department of Health and Human Services that are nonprofits, and they're finding it very, very difficult to get insurance. For many of them, their insurance has been canceled, and if they don't have insurance, they cannot continue to do business with the state of New Hampshire. So what I did was put together a study committee to have us take a look at this. We're talking about giving some sort of limited liability to these nonprofits, and that sometimes is not a very popular thing to do. But I do think we have to, in one way or another, address this issue, because the state does depend upon nonprofits to carry out a lot of our mission, especially concerning children. And we can't, I don't think it would be good policy to let these organizations go to the wayside just because we can't seem to figure out a way to help them. So again, this just creates a study committee to look at this issue and come forward and advise the legislature on a path forward. Thank you very much, Madam Chair.
Okay, are there any questions? Representative Yokella.
Thank you for taking the question. So the hurdle that you're trying to find out more about is that we may not be able to continue doing business with certain places because they don't have insurance. Do we know why they don't have insurance, and what is or why they are getting denied, or maybe that this is maybe an insurance issue and not like we want to be in working with them, right? But they are not meeting our qualifications through no fault of our own, but maybe through the insurance industry. Is that what you have come to believe?
Thank you for the question. It has more to do with, I think a lot of it has to do with the insurance, but there are folks here from some of those organizations who would be able to answer your question much better than I can.
Representative Belanger.
Thank you, Madam Chair, and thank you, Senator, for being here today. My question comes in two parts, if I may follow up after that, Madam Chair. The first part is Belanger nonprofit is denied insurance, but it would be easier for Belanger LLC to receive that, but we're still providing the same quality of service, correct?
Again, Representative, I don't deal with the insurance aspect of it. They're here and they will be able to explain their experience to you much better than I can.
Got it. Thank you, Senator, and if I may follow up, it's just to try to comprehend what's being done here, but essentially this is seeking to understand what's going on, because we don't quite understand what's going on. Is that?
I think that, thank you, Representative. I think that's part of it, but it's also to see if we can find a path forward to deal with it, because we have been doing business as a state with some of these organizations for a long time, and now they're faced with these changes. And again, if you look at the duties, it says the committee shall study the feasibility of extending limited liability to nonprofit organizations. So that's what you're going to do, and you will bring all the players to the table, and hopefully this committee will be able to hammer out whatever we need to hammer out so we can move forward.
All set? Are there any further questions? Representative Altschiller.
Thank you, Madam Chair, and thank you, Senator, for bringing this forward. About how many agencies are we talking about?
Thank you for the question. I don't believe we're talking so much about agencies as we're talking about nonprofits. And there are some of them here who would be able to talk about that much better than I can. I hope I've answered your question.
May I follow up?
Follow-up?
Yeah. My bad for using the wrong verbiage. Nonprofit, and I was thinking nonprofit agencies, so I did not mean to confuse that with state agencies. So about how many nonprofits have approached the state saying we're having this?
Quite frankly, quite a few have
Yeah.
approached me on this particular issue.
Yeah.
And in fact, I was asked to bring in a bill that would give them that limited liability, but we got a lot of pushback from the attorneys, the trial attorneys, and a number of other organizations that just do not like the idea of limited liability. So hopefully one of the charges of this committee would be, we're going to bring these all people together all in a room and hammer this out and figure out a way forward.
Are there any further questions? Seeing none, thank you.
Thank you very much, Madam Chair.
Up next is Keith Keening from Waypoint, who's asked for 4 minutes.
Would it be all right if Dominique Whitten sat
And
with
I
me
have
also?
Dominique Whitten, who is going to sit with Keith Keening.
Thank you, Madam Chair. Thank you, members of the committee. Good to see all of you. It's been a while. My name's Keith Kinning, for the record. I'm the Advocacy Director at Waypoint. And we want to thank Senator Carson for bringing forward this bill. So in 2019, we brought forward a similar bill asking for limited liability. We had not lost our insurance yet, but we were concerned that either we were going to lose our insurance or that the premiums were going to go up so high we wouldn't be able to afford it. The main program that we're focused on here is the foster care program. It's called ISO. Dominique actually works in that program, and so I thought she could give you an idea of what kind of kids and what kind of needs these kids have, about why it's so important that this program is around. So this year, after that bill didn't go forward, and I believe the word that was used was they didn't think the issue was ripe enough at the time. The things that we were predicting hadn't come true. Now the things we had predicted have come true. We have lost our umbrella insurance for our ISO program. Once does not a pattern make, as my mother would often say, but now we've also found out that Spalding Youth Center has also lost their umbrella insurance. And so I think what we're seeing out there is, with the large number of lawsuits that are going forward, especially when it comes to foster care, abuse and neglect, what's happened at the Sununu Center, there are a lot of people out there that are reconsidering whether they should look into suing the organizations that have provided these services for them. And we are at a crisis point, quite honestly. We work in lieu of the state. We do the job that the state doesn't do, and if the state loses us, I'm not sure that there's going to be anybody around to do the work that we can do. That doesn't mean over a number of years maybe the state couldn't do that, but right now they can't even fill all their CPSW's positions, let alone to go out and hire a whole new staff to replace the people that need in order to do this kind of foster care. And so we truly are just looking for some kind of committee. We think the answer might be to limit our liability to what DCYF's liability is. It's $475,000. I can tell you there are organizations that don't agree with that. Perhaps there's a better solution out there that we don't know about. But I think bringing lawmakers and the different people together to say, these kids need protection, how do we find this protection, and how do we continue to support organizations that want to give these services would be really great. So I want to thank you for your time. I'm happy to take questions now, or if you want to wait until after Dominique speaks, it's whatever you want to do. So thank you.
Representative Yokela?
Thank you for the taking the question. When you say you've lost the insurance, do you mean that they refuse to offer you insurance, or that you declined the premiums that they offered?
No, thank you for the question. They informed us that they would no longer provide an umbrella policy for us. We do have an underlying policy of $1 million, which, as an attorney, and as most of you know, in this day and age, that's not a lot of money, especially when you're looking at somebody bringing a lawsuit from the point where they're 15 years old and this will have damaged them for the rest of their lives. We have been told, and Spalding has been told, that there is no umbrella policy for you. We do not have an option to buy it. It wasn't presented to us at any cost. we could not get an umbrella policy.
Thank you.
Representative Belanger.
Thank you, Madam Chair, and thank you, Mr. Kuning. And I'm sorry, I didn't catch your name. Dominique, and thank you for being here today. So, prefacing this, I too understand with the job that I have. I just found out that they were just canceling us because they were no longer doing it.
Yeah.
So just, and I'll ask you the same question that I asked the senator. Belanger, a nonprofit, is providing X services to the state, and I get a phone call that said services are no longer being insured. However, Belanger LLC is now allowed to procure that insurance. Is that what's going on here?
So thank you for the question. I have no idea whether I think this is one of the reasons we would like to have the committee to see where the impact from these cancellations are happening. Again, that may be a solution. I don't know. All I can tell you is the two nonprofits that we know, and Spalding is a pretty big organization, and they are very concerned about this. I think the thing you have to understand is the children that we take and the children that Spalding takes, this is like juggling nitroglycerin. These kids have been through hell, right? You're bringing and taking care of kids that are incredibly damaged. And so when we take them on as a client, we're trying to solve problems, but it's very difficult for us not to get pulled into things because these kids have so many issues. But whether we could somehow, part of us go back under an LLC, or whether the private corporations that provide this are getting better insurance or whatever, I'm not sure, Representative, but I think it would be something that we need to have answered. And again, I think the committee would be able to pull people in, we'd be able to get the answers to this. And then, as I've said before, I don't think we're just looking for one solution. If the cap is not the solution, that's fine with us. We just want to be able to provide the services to these children that need it, and that's our goal. So thank you. I don't know if that answered what you needed or not, Representative. I would have to say I'd have to look into that deeper, Representative.
Representative Smith.
Thank you, Madam Chair. Thank you for taking my question. What was the reasoning behind the insurance canceling you? What did they say? Did they say any reason?
So, thank you for the question, Representative. They don't tell you why they're pulling the umbrella policy. I will tell you that this is, since all these things have started happening, it's just more and more people are coming forward. I think they just think it's just too huge of a liability for them to take this on, and they'd rather just walk away from it than to possibly get on the hook for a verdict that could leave them millions and millions and millions of dollars that they have to pay out. As I said, you know, when these kids are, I think some of you remember back, there was a case where, you know, two kids were taken into the bathroom by their parents. This was, I don't believe this was an ISO one, but those children were excuse me?
It was a parent aid.
Parent aid, but those children were sexually abused by the parents during that incident. And I believe the payout was someplace in the $7 million range. So I think a lot of these insurance companies are just saying, you know what, these kids are really damaged to begin with, and we're just not going to take the risk of going, you know, it's kind of like, right, you can't buy flood insurance near the ocean. That has to be a federal program, because most of the insurance companies say it's just too dangerous. And I think that's where we are. We didn't get an explanation, but I can guarantee you that's what's going on in their minds.
Representative Yocala.
Thank you. Thank you for taking the question. It seems like you are wanting the study of specific organizations the nonprofit organizations that deal with, that contract with the Department of Human Services, and not all nonprofit organizations having the option to be limited liability. And then I don't really understand how you would know before you've made your declaration of, like, this is my business and this is my type of business. How would you qualify for, like, if you're not allowing all nonprofits to be limited liability, then you would apply, after you form the business, you start doing good work, then you contract with with DHHS and say, okay, now you want to hire us to do this work. Now we're going to get limited liability, like in a different classification than we originally formed the business. Do you see that is like a restructuring of the business, like midstream, as something that is problematic, and you would really think that you should be allowing all nonprofits to have limited liability, or are you really just seeking a special like reformation of the business once they get a contract with DHHS?
Sure. So, if
Yeah.
it's all right, Dominique would like to.
So, a lot of the problem that's coming up with the insurance is because ISO and child placing agencies are working directly with the state. And because of DCYF's history and juvenile justice's history and the level of risk that these children are exposed to when they're not placed with their parents, that's putting a lot of burden on our programs to go and do a lot of extra work and verification. As far as an ISO agency being for-profit or not-for-profit, my personal opinion, and this is not the opinion of, I'm not representing Waypoint when I say this, the service needs to take place. These children need the help. And so if we're putting the service providers at a higher level of risk for taking this work from the state, because the state has a cap and we don't, we're not only putting ourselves in danger when we're walking into homes that have significant child welfare concerns, significant safety concerns, but we're also putting our agencies at a higher level of risk because we can't control all of the outcomes. We don't have decision-making power. And I can reflect a little bit more on that in my testimony, but really what's happening is we're being made responsible for decisions that aren't ours to make.
It would be all right if I answered the question also, Madam Chair?
Yep.
Yeah, so, Representative, I mean, if we said that we wanted to expand it to all nonprofits, I think every nonprofit in the state would cheer. I also think you'd have so many trial attorneys in here, we wouldn't be able to breathe. So, I think what we've learned over the years is that we try, and I've talked to Marissa, we've talked to people from the trial attorneys. I think good legislation comes from solving the problem in front of you. We don't want to be too broad. And what we're bringing to you is what's happening to one particular program at this particular moment. And I think what I've learned over my past 10 years of advocacy is not to try to go beyond that too far, because then you're solving problems that don't exist. And so, I think you have to understand there are different programs with different levels of liability and risk. And this program, the reason the insurance companies have stopped this insurance is because the risk on this program is so incredibly high, because the children have been through such terrible circumstances. And so I guess what I'm saying to you is I'm sure the nonprofit community would love to have their liability limited to $475, but we have tried to explain it to everybody we've talked to, including the trial attorneys. We're asking for something very specific here. On this particular program where the state hires us in lieu of their efforts, we need protection because we no longer have an umbrella policy. And that's all we're asking for at the moment.
Are you all set? Okay. Are there any further questions? Representative Long?
Thank you, Madam Chair. Is there any possibilities that in high-risk situations such as this, you could pay the premium to the state to cover you?
You know, thank you, Representative. It's a great question. I mean, I think some of us, I reflect back on, I believe this happened to the OBGYNs years ago, right? Where they had to establish some kind of state fund because they were having difficulty finding reasonable insurance. As I said at the beginning of the testimony, we came up with a solution saying to limit our liability. There may be a better solution through the insurance department, and we'd love to sit down with the trial attorneys and others and try to find the solution. All we're asking, we're trying to find a solution that keeps our program open to keep helping the children. That's our bottom line. That's all we want to achieve. And if there's different ways to achieve that, we are more than welcome to hear what those are. And there may be other solutions. And if the state would like to get involved in that way, that would be fine too.
Very good, thank you.
Are there any further questions? Seeing none, thank you very much.
Can I ask you a question, Madam Chair? So Dominique was just going to tell you just about some of the children that are in this program. Would you like her to expand on that, or since the questions have gone on so long, that's up to you, Madam Chair. She was just going to tell you. Would you mind just telling them?
No, go ahead.
Is that all right?
Oh, yeah.
Okay.
All right, so ISO services are wraparound services for families that are involved in child welfare to the extent that they are either at imminent risk of placement or they've already received a finding. We work with individuals involved in juvenile justice, and we work with families that are involved with child welfare. The services that we provide are really, their intention is to prevent institutionalization. Their intention is to make sure that the family has an opportunity to reunify, and if the family can't reunify, the child has the ability to build trusting relationships with adults so that they don't wind up in a long-term institutionalization situation. We do some pretty life-saving work both with children and with their parents. For parents, a lot of our work is to address safety barriers to them, like substance abuse, domestic violence, significant criminal activity. And then for the children, we're working with children who have been put significantly at risk. I've worked with children who have fallen from windows, several stories up. I've worked with children who have experienced firearms being let off in the home. And I've also worked with children who've gone through some really traumatic loss related to domestic violence. And all of these children are served by these programs, regardless of who they are, all around the state. There is a really good reason that this service isn't provided by the state of New Hampshire, and that is that the state of New Hampshire, as we've all heard Commissioner Ribson say, is a law enforcement agency. Child Protective Services and Juvenile Justice and Probation, their job is to make decisions that are going to impact the lives of these children. Our job is to provide treatment, and our job is to provide them with the information that they need to make a choice. Asking the state to take on that work really disrupts the trust. It reduces clinically evident practices and services, and it would likely reduce the amount of time that these children and these families are getting from their service providers.
And just lastly, and I promise I won't say another thing unless I'm asked, is I think the difference between foster care and what Dominique does is foster care, they might check in on them once a month. Literally, ISO programs, they're checked in 5 times a week. That's how much care these kids need. That they have an entire staff of people coming in to talk to these kids and help these kids. And so that's why I keep saying these kids are at the deep end of need, and that's why it's so hard to, how desperately we need to protect them. So I will stop there, but thank you for your time, everyone.
Are there any further questions? All right, seeing none, thanks so much.
Thank you.
And up next is Marissa Chase from the New Hampshire Association for Justice, who's asked for 1 minute.
Good morning, Madam Chair. Morning still?
Yes.
Members of the committee, thank you for allowing me to speak today. I represent the New Hampshire Association for Justice, which is a statewide organization of professional trial attorneys. So we are the trial attorneys that have been mentioned. I wasn't planning to testify today. We support the concept of a committee to study these issues rather than the blanket, liability protection that was suggested in 2020. We vehemently oppose that bill as drafted because it's so expansive. When you're talking about taking away liability, that's really taking away accountability. And as we heard, these kids are in high-risk scenarios. There are a couple of points I just wanted to make. One, we have met with Keith, would love to continue speaking with Keith and folks at Waypoint. I believe, and Keith can correct me if I'm wrong, there are about 10 organizations in the state that currently provide ISO services. It is no doubt been proven by data since the 1930s that kids who are in bad homes do better staying in those homes and getting services like ISO than they do going and being institutionalized. The problem we have is that if you cannot write any one specific entity into statute. So while Waypoint, I believe from our research, has only been named in a lawsuit once in the past 10 years, the other organizations have been named much more often. And there are some really troubling facts out there. So we're trying to find a way that ISO services can still be provided without granting immunity to these other organizations who may provide ISO services, but are also engaging in negligent hiring and their staff are abusing children. So I understand it's a tricky balance to make. It's, no doubt that ISO is a very important function for about, I think it's between 130 to 150 families a year, but 130 to 150 families a year versus thousands of kids in other placement entities run by some of these same organizations. So I'd be happy to provide follow-up with written testimony with some of our concerns, but again, we like the idea of a study committee to really get down to the heart of these issues and be able to have those conversations.
Okay, are there any questions? Representative Long.
Thank you, Madam Chair. Thank you for your testimony. Is it possible, you may not be able to answer it, but I think your trial attorneys may. Is it a possibility for the state to contract the insurance for these high-risk entities?
I don't know. I did a survey through our national organization to find out if this has been approached in other states, this idea of limiting liability for these private placement entities. I could not find any surrounding states that have been looking into that as a possibility, so I don't know if there's like a blueprint out there for that. Right. I just don't know.
Okay, thank you.
Are there any? Representative Yokella.
Thank you for taking the question. When you're talking about these, maybe not Waypoint, but other companies being held liable for their employees doing things that were inappropriate, it seems like the question that Waypoint is trying to address is things that may have happened that are outside their control and not actually, not necessarily that they're trying to shirk responsibility for what they've done, but for things that they haven't done that maybe decisions were made by the state or a different person. They were just there, right? And they were not law enforcement, so they can't do, arrest someone or something like that that's creating some hazard, but may if they don't handle it correctly be held liable for that. Do you think that it would be possible to limit the liability of things that they don't have direct control over without creating a protection for things that they are doing that are incorrect?
So I will start, I'm trying to get my thoughts here. There's a legal principle called respondeat superior. That means when you are a business, you assume responsibility for your employees. And that's a way for the business to ensure that they are, meeting all the, licensing requirements or accountability that are out there, they're in compliance. So the way to change a bad actor is to hold them accountable. So even though, Keith at Waypoint may not be directly responsible for something that goes on in a home, the organization is responsible for their activities. I will also say it is very difficult to bring any of these lawsuits. There's a court rule, Superior Court Rule 40, that caps attorney's fees at 25% when they're representing children. That is not great incentive for any lawyer to bring these cases because these cases are taken on contingency fee. That means that the lawyer fronts all the costs of litigation up front and only gets paid if and when they are successful. And again, their fees will be capped. So the attorneys that take these cases are really, it's out of a public interest. I could think of one attorney who's a former public defender who has taken a few of these cases against these private placement facilities only when there is criminal conduct found and it's been referred to him by a public interest lawyer that says, hey, like, this is really bad what's going on here, can you take a look? I don't know if that directly answered your question. Our concern with the legislation introduced in 2020 was that the way it was drafted, it would apply to anyone who contracts with the state. So someone joked, oh, if Panera caters an executive council meeting, will they be granted limited liability? So I understand that there is a very careful balancing act that needs to take place, and I'm looking forward to a greater discussion. I don't know if I answered your question, I apologize.
Are there any further questions? Seeing, oh, Representative Smith.
Thank you, Madam Chair. Thank you for your testimony today. The ISO works directly with DCYF, correct?
I don't work for the ISO. I think
okay.
Yes, okay.
Yeah, so I was just wondering why you wouldn't fall under that DCYF umbrella for insurance.
Sure.
No, come on up. More the merrier.
From your mouth to God's ear.
Well, there's your answer.
I think, I do think that the trial attorneys have a point. I think this goes back to what Representative O'Kello was saying too. We're being pulled into things because of what other things are happening around us, and that's affecting our ability to serve these kids. And I think, Marissa, we have had very, civilized conversations, and I look forward to having those also. But I think the question becomes, how do you solve this problem? Perhaps just in this ISO. And let me make very clear, we are not asking this just for Waypoint. We're asking for ISO, ISO programs. So
right. Excuse me. I'm sorry.
Could you speak into the mic, sir, so that people listening at home can hear?
I didn't mean to barge in on you, Marissa.
Can I have a follow-up?
I'm sorry.
Follow up.
So how does the child get services from you once DCYF is involved, correct?
They refer the family to us.
Okay, so I was just wondering if you could be under their umbrella where you're kind of contracted by them.
So thank you for the question. That is what we're requesting, that if we're working in lieu of the state and contracting with the state on a particular ISO programs, and if the other bill was too broad, we're asking for a narrower definition now, is that because of the high risk of these children, that we would have our liability limited to the state on that particular program. And not just for Waypoint, but for any agency that deals with these kids.
Okay, thank you.
Did that answer your question?
Yes, thank you.
Are there any further questions? All right, seeing none, thank you very much.
Thank you. And Madam Chair, if I may, just one last comment. When we're talking about people getting pulled into other lawsuits, there is a practice where, it's not just the plaintiff attorneys just going out and naming everyone. There's a case that has become great precedent called De Benedetto, and Keith and I have talked about that before. And that's where, to shift the burden of liability, defendants will name co-defendants because they try to spread out responsibility so that they are not accountable solely. So plaintiff attorneys aren't always the bad guys, I guess is what I'm trying to say.
Okay, we'll take note of that.
Thank you.
All right, thank you. Okay, so I'm going to close the public hearing on 457. And before everybody runs to lunch, so next week we have scheduled 3 bills and then I am hopeful that after those we'll be able to exec all of our bills, so we don't have to come back another day if it's not necessary. I mean, if we run into something that we need to, then we'll have to, but if we can. So any proposed amendments for the bills we heard today or whatever, if you want to, anybody wants to get them or whatnot. And then to the Republicans, we will caucus at 9 o'clock next Tuesday morning. Okay. Is everybody else set with
These are
that?
the only Senate bills we have?
These and the ones that for next week. Yep, there's 3 for next week. Yep. Yep, they were left at your seat.
478.
478 or 458?
One of them. 458.
Yeah, that's the Sununu one that she said she was gonna get, so we'll make sure we get those. All right, and then we will go to lunch and we'll be back at 1.
Madam Chair,
Yeah,
the chair of EDNA came in this morning before, just wanted to ensure that some people will be
Yeah.
going to the joint hearing.
yeah, I'm going.
Okay, great.
And anybody else that wants to go, well, you're gonna have to stay here and run if we're not done by that time, but yeah, I'm hoping that the last bill won't take that long, so we can all go to EDNA. Yeah,
I'm planning to go to judiciary because we're having some of our bills heard in
Okay.
judiciary to testify that. And so
Okay.
that's why we're kind of spread all over the place. It's
yeah,
concern.
welcome to the legislature.
Okay.
Right.
I just wanted to make, because she came in and wanted to make sure that hopefully that someone will come. But if someone
Oh,
won't,
yeah,
then
I plan
that's
on
good.
being
Okay,
there.
great.
All right, so, everyone enjoy your lunch. I'll see you back at 1.
Yeah.
All right, I'll check one issue with the, when we put that. So I'll have it all organized. Thank you, I appreciate it. See you next time. And let us know what our caucus.
Yeah, we'll caucus, I'll get a Zoom caucus.
No, we're
Yeah.
fine.
I'll get a Zoom caucus together.
Hi, good afternoon, everyone. I'm going to go ahead and open the public hearing on SB 336, and I will call in Senator Sue Prentice, who's asked for 5 minutes. Oh, there you go.
Good afternoon. Again, for the record, my name is Sue Prentice. I'm the state senator from District 5, which is there's 9 communities in the beautiful Connecticut River Valley of New Hampshire. Good afternoon, Chair Rice and members of House Children and Family Law Committee. For the record, again, I've already stated my name, and I'm here today to introduce Senate Bill 336, which establishes qualifications and the appropriate instances of inclusion of qualified family mediator interns. And I just want to say on the outset, I have very brief testimony, and I have members of the family mediator, certified family mediator community here with me. This has to do with some cleanup that was requested by the judicial branch, and it's also a workforce bill, because by doing this cleanup, more family mediators can be trained and go through internships. So I just wanted to put that on the record, and I will follow with my introduction. So the Family Mediator Certification Board is a small occupational regulatory board under the Office of Professional Licensure and Certification that regulates divorce and parenting mediators. Certified family mediators assist parents facing divorce and separation resolve family issues without the court. In order to become a certified family mediator, a student must complete an internship. However, the pathway to these internships needs to be cleared, as the absence of official language recognizing these qualified interns, and that's defined under RSA 328 C5 1 and 2A and C as part of the proceedings, has become a barrier. So what they're saying is, in these sections, without this proper definition, we can't have these qualified interns in anywhere within the judicial system training. And again, Honey Hastings and Esther, they can provide further clarification. This legislation would go far for solving the problem by opening up these internship opportunities and officially recognizing interns in the proceedings as required by the judicial branch. I ask the committee for your support on an ought to pass motion, or ought to pass recommendation, I should say. And this was amended in the Senate, and the amendment that was made by Senate Judiciary had to do with making sure that interns, these qualified interns, they couldn't be alone in a proceeding or alone in a room. They had to have pretty strict supervision, and that was again an amendment that was made by Senate Judiciary. And so with that, I will thank you. I will close my testimony. I will for my introduction and testimony, and happy to take any questions you might have.
Okay. Are there any questions? Okay. Well, seeing none, thank you very much.
Thank you. I will stick around, and if you have any, I'll be here. Thanks.
Thank you. And up next is Marianne Dempsey from the Judicial Branch for informational purposes.
Good afternoon, members of the committee. I indicated I would be less than a minute, so get your watches ready. We appreciate the opportunity to work with the sponsor, but the folks from the mediation group who drafted this legislation. It addresses the concern the judicial branch had regarding confidentiality. We are certainly supportive of the role mediation has, particularly in family law cases. So we are here to state that it does address our concerns, and I'm happy to take any questions.
Okay, are there any questions? Representative Altschiller.
Thank you, Madam Chair. Thank you very much. The program exists now.
Yes.
And is there an expectation that with further clarification, our program will be more attractive?
You know, the program our mediation program certainly has a large number of participants. There was 1,800, I believe, family law mediations in the past year. This is really to allow folks to obtain the training by participating in those mediations so that they're then able to conduct them themselves. So I see the judicial branch only sees it as a positive thing. I don't know that it'll be more mediations, but it may be more trained mediators, and that's always a good thing in the court system.
Follow up?
Thank you. And if we grow our capacity for family mediators by expanding on this internship program, will that pave the way for further opportunities here to keep those interns as state residents doing mediation, maybe?
I would see that as certainly a benefit to this program as well. I'm sure that the sponsor and the committee could speak to that. But from the court perspective, we welcome the intern and the educational opportunities.
Okay. Are there any further questions? All right, seeing none, thank you very much.
Thank you for your time.
Up next is Honey Hastings, who is a family mediator, correct? She's asked for 5 minutes and does have written testimony, and she is also passing out testimony from someone who couldn't be here. Hers is the pink one. I don't think so. A long time ago. Oh, can you turn on your mic? There you go.
Is that it?
Yeah.
Good, thank you. That's new. I haven't been here in person since that happened. It's a plus. I've been watching you. And other committees of interest. My name's Honey Hastings. I'm a retired lawyer and I've been a mediator, a certified mediator since 2000. I'm still practicing mediation. The problem is that people are having trouble getting internship hours and thus they don't become certified. They do not then be able to offer their services to the court, who screens people and chooses the people they want, but there's a smaller pool because of this problem. And when the court indicated the reason that they changed the policy and said that interns could not work in the co-mediate in the system was some changes were needed in the statute. Well, you know me, changes in the statute. You know, that's a solvable problem. And with your support added to that we got in the Senate Judiciary, this problem will be solved. At this point, interns are only allowed to observe. And so there's the shortage of people. And in fact, there are two emails that I think you got, one from Linda Bauer, who's a licensed social worker, and she got the training, but she couldn't get the internship hours. So she is not a certified mediator, and it would have been her particular background and skills would have been a nice addition to the profession. Maybe when the bill passes, she'll be able to do that. There's also Susanna Schweitzer sent in an email. It took her more than a year to get the internship hours. She did succeed in doing it and is now certified. So there's the numbers thing. There's qualified people being able to get the internships and thus be able to do the court work. But there's also court cases are different in my experience. And I did court work for a lot of years. They're often tougher cases. Private mediation, people haven't filed court papers, haven't started making charges back and forth, haven't had court events. And they're often not as antagonistic towards each other. People who've been in court, have had a losing decision in a temporary hearing and then sent to mediation. They're tougher. They're tougher. And also there's more cases where the parties were never married to each other. I don't I've only had very few private cases with that scenario. Most of them are divorces. And somehow those never married cases are tougher. Maybe they only had a brief dating relationship, you know, they have no good times to look back on. So not having the experience with the mix of court cases is a disadvantage, I think, in addition to just the number of people coming in. This bill is a product of a committee called the Future of Certified Family Mediators that was set up by the chair of the New Hampshire Conflict Resolution Association, because we were all talking about it within the profession, and it seemed like it was something that it would be hard for the board itself to take on, especially because, as I'll speak later, they're having trouble with quorums. So we went off, a bunch of us that were interested in policy, and came up with it. It essentially breaks down the internship into 2 steps. All the steps for becoming certified, other than the internship, are step 1. If you get all those papers and courses and training in, and the board reviews it, you can become a qualified intern, a new term. You then have to get the internship hours, and only when you add the internship hours to the paperwork and training can you possibly become a certified mediator. By breaking it down, the court is assured that the people that are being brought in as interns have the suitable training and education and background check, etc., all the things that have to happen other than the internship. In fact, I think it may even lead to, if this bill passes, to more mediators being willing to take on interns, because they will also be reassured that the qualified interns have already jumped through a bunch of hoops. So I think that this will have a very positive effect on the availability of mediators. The next to last paragraph in the bill was something that was also added in the Senate, and it's because the board has had a continuing quorum problem. In fact, the board was to meet today, and it's not, because it's lacking a quorum. In 2021, many occupational regulatory boards had their statutes amended to replace a number for a quorum to the language that says a majority of the members of the board appointed by governor and council shall constitute a quorum. Somehow they didn't get this magic language in for the mediator board. The mediator board needs it because it's got 2 members that are appointed by the judicial branch. And in fact, one of them can't attend today, and it's the reason why there's no quorum. So if you would simply add that, you know, that's a kind of, it's a small minor issue, and yet the board repeatedly has not been able to have its meetings due to lack, and this is why we asked the Senate to add this, and they did. I'd be happy to review, of course, to answer any questions. I'd be happy to review the sections of the bill if people want that. Whatever would be helpful.
Okay, are there any questions? All right, seeing none, thank you. Up next is Esther Wolf, and I just want to apologize. I have to be somewhere at 1:30, so I may have to run out if we're not done. Esther Wolf to speak in support of the bill, and she is a certified mediator, supervisor, and trainer.
Hello, everyone. Good afternoon. Thank you for your time and all you give to the state of New Hampshire. I actually see no downside to this proposed legislation. I've been mediating actually since we were certifying family mediators in New Hampshire, and so which is back in the earlier 90s. And I think that specific to the legislation, and I think really an important piece is being able to create the level of and volume of opportunities for people to intern with certified family mediators, a lot of whom are court contracted. I have a private practice with a business partner, but honestly, the bulk of work that we do for a lot less money than if we're in private cases is with the court. And those can be some of the most challenging cases, which frankly interests me. And I think that our goal in general as professional mediators is to try to provide the highest level of services to our community here in New Hampshire and where else, we may serve people. And to do that is to be able to provide the opportunities for more internships and more hands-on active, if appropriate, co-mediation. Co-mediating observation is you sit and watch, and I have used this before, and anyone who's in the room with me, I don't care who they are, signs a participation agreement, and it takes the pledge of confidentiality. Frankly, I think it's always been that way, but I think we need to reassure people about that. So I do think that once people take the program of instruction, which is part of that first component, and they have to work really hard to find internships. I do have interns. I have a couple now, and other people do as well, including my business partner. But a lot of people have found that they've gotten turned down, and I think that where no one gets paid more than a modest amount for any court case, it might be easier for some of the certified mediators to feel like they can take on an intern as part of that process. But I came from mediation this morning over in Brentwood, and it was, and it reminds me of why I do what I do, and because people are coming in at one of the hardest times, and they need help getting apart. So whether you're the therapist who Heidi mentioned, Linda Brewer, who and I know her, I trained her, and frankly, she's doing some internship time with me at the moment, but only under observation, and I'm waiting for my next private case. But I think that those are just, in general, more challenging. Whether you're dealing with millionaires or people who come in and know they're supposed to pay and can't. And you have to learn to deal with all those things with professionally and grace. And I think that there are more opportunities to do that through the court program.
Are there any questions? I can only see this as a bonus, right? This is going to get more
Absolutely.
mediators. We already know we're short on them, which is causing more problems in the backup of the courts. Correct?
Absolutely.
Okay.
Absolutely. It's been
I just
certainly
had to form it in a question.
What's that? Oh, yeah. Oh, okay. Okay. Hold on. So, honestly, I've been mediating in and out of the courts since the mid 80s, and I mediated probably in most counties and most courts, and I, on occasion, used to get called from a court saying, hey, who's this person who's does this mediation? And because they had some people who, especially some of the parenting cases and the post-divorce cases, where they're truly high conflict, no communication cases, and there's a huge need. And that's why I've chosen to focus on family and, some probate as well, family from kind of pre-birth to death cases, because it's so important, and it helps de-escalate situations to help parents do what they need to do. Anyways, but yes, there is a real need for it, and there is a shortage, and I do hope that more people will take on interns, with the passing of this legislation. So,
All right,
anybody
great.
else?
Thank you so much.
Thank you so much.
Okay, so that was my last pink card, so I'm going to close the public hearing on SB 336.
The one that bothers me so much is when I get to ether. That I don't really like that so much. Yes, I was too. How long ago did they? Well, the market's been crazy everywhere, including. Oh, I know. I almost went to Yeah, I know Foster's very much. So,
No worries. No worries. But thank you so much. I really appreciate and voice on the phone and the name of it now, but it's the reputation.
what kind of side might go off?
Yes. So thank you so much.
I hope it all works out. I do, exactly. A lot of go through one. So I do those kind of cases for the courts in New Hampshire, so the state equity matters.